No. Yeah, no problem. Yeah. Yep. Yeah. Now it's off. Okay. So I don't remember last time we did some brief introductions. It's very brief. Yeah. Yeah. I just yeah. I just want to show everybody this. I don't have to though. Yeah, that's great. Okay. Okay, that's great. Are you Dr. Lebu? Are you Dr. Lebu? Do you have a doctorate degree? HDC. Got it. Yeah. Okay. All right. We're live in about 2 minutes. Yeah. Okay. Okay. Do we hit go? We are live now. Okay. Awesome. You want to start quick introduction, Val? Uh, do a brief one in French. Yeah. Hey, everybody. Dr. Nate here from Colorado in USA. Really excited to speak with you all. We tried to do this earlier in the week, but some power outages delayed us until today. And actually, I think this is a good demonstration of what our education will do for you, because when we come to Africa, to Cameroon specifically in March, we want to teach you skills that are not dependent upon utilities or power. I spent 20 plus years in the US Army, and there were many times that I was in the field with soldiers and I did not have tools, I didn't have electricity, I had my hands and I had my brain. And we want to teach you things that you will be able to do to intervene with your patients that you're carrying with you all the time. So this is great medical care that is not dependent upon uh, power. It's dependent upon you and your knowledge. So for today, we're going to focus on some neuroscience. I'm going to give a high level view of a couple of key principles. And then Val, our PhD candidate, is going to give some more specifics. And we intend to instruct and educate from entry level all the way up to graduate level. And if you feel like we're a little bit too detailed when we get to the graduate level, that's okay. We want to at least start with introduction and then build upon that to improve your level of education and your level of training. So with that, let me present my screen real quick here. Okay. Are you able to see that screen? Val, tell me what you're seeing. It's good? Okay. Good, good. Okay. Please chime in if we have any technical difficulties. So, as you know, we call our training the NMT, Neuromusculoskeletal Manual Therapy. Again, today we're going to focus on some pain neuroscience. There are three main principles that I'm going to cover with you today. And these, I would like for you to be able to explain these three terms by the time we're done. The first is called central sensitization. The next is long-term potentiation. And the next is long-term depression. So, central sensitization has to do with how your body perceives pain at the level of the cortex. And long-term potentiation and long-term depression has to do with neurons within the spinal cord, specifically neurons of the dorsal horn of the spinal cord. So let's cover a little bit about how this works. If we have, let's say, an injury, let's say it's an injury in the hip, those pain signals are relayed through neurons in the dorsal horn of the spinal cord. So each of these blue lines represents a different neuron. And those are all traveling through the spinal cord in this area here of the dorsal horn of the spinal cord. And their job is to relay pain signals to the cortex where we feel pain. Now, when we first receive an injury, let's say it's in the hip, initially that's going to go along one neuron. If we continue to have pain in that hip, let's say over days or weeks or months, then that leads to a problem that we call central sensitization, where this portion of your brain that receives pain has been sensitized to feel the pain maybe even more easily. There's a really good study that covers this where they gave rats, and I feel sorry for these poor rats, but rats get a little hind leg injury. And they do this pretty simply. If you imagine like a hair dryer, they have a tiny, tiny hair dryer, and they give the rat a little heat injury in the back leg. And that injury is this big. And then they test the rat's pain. And the rat reports, yep, pain right here in the area where I got the heat injury. Well, they did this study multiple days in a row where they gave the rat a hind leg injury. What's up? Oh, they're not seeing it. Yeah. Yep. Let's do it. Here, let me try. Yep. Let me. They're not seeing. Yeah. Are they not seeing the picture? Let's try this again. I closed it and I'll open it again, make sure that we can see it. What about what about now? Val, are you able to see it? And Val, I can't hear you. Let's see. We'll just pause here for a moment until we're sure that everyone can see it. You see it now? Oh, yeah. Let's mhm. Can you see it now on YouTube? Uh-huh. I can you see it now? You should be able to see it on YouTube. Hmm. I'm sharing it to YouTube and to StreamYard. Should be seen on both. Okay?